Are we live?
We are live.
Hey, hello everybody. I'm going to put my phone on airplane mode so that I don't get interrupted. Should have done that earlier. Apologies. All
Yes, the
right.
host
Hey
of the
everybody.
presentation needs to be on airplane mode.
I don't you hate that when people are their phones buzzing, ringing? It's like, no, that's not good. Hey everybody, thanks for joining us tonight. I am Fritz Gilbert. Thanks for reading my blog. If you're here, you're obviously a reader, so I appreciate that. I am more than excited about having Ari Parker here. If you guys were with us in October, we had a kickoff webinar with Chapter. These guys are the real deal. I'm very impressed with what they put together. I'll read a bio here that gives you some background on Ari, but let me just tell you kind of why I've decided to partner with them. When I think about Medicare, I recognize the complexity of it. I don't want to become an expert in Medicare. I got too many things I'd rather be doing. These guys are the experts. They've got a proprietary algorithm that automates, and this isn't a sales pitch. I'm just putting this up front why we're doing this. They've got a proprietary algorithm that scans all the plans and looks at different things, looks at your situation, and they can just tell you this plan's the best one for you. They can help you sign up. It's all free. It's great. People go, how do they get paid? How do they get paid? I get that a lot from my readers. Anytime you're selling Medicare plans, there are commissions that come with that. The thing that I really liked about these guys is their agents don't see those commissions. And a lot of times agents get influenced by higher premiums on one plan than another. So they might not be giving you honest advice because they're trying to get their higher premium. These guys don't see it. It's not a part of their business. They're just trying to do the best for you. Ari, maybe you can tell a little bit at the beginning about your story and the background of why you started Chapter. I think it's a great story, but let me introduce Ari for you. Great guy.
Hold on, let me show the slides.
What's that?
Let me show the slides.
Oh, okay, here we go.
There we go.
All right, here we go. Ari is the co-founder and the head of Medicare advisory at Chapter. I really recommend this company. I'm just being straight up with you. I'm going to use them when I'm only 62, but in 3 years, I'm absolutely going to use these guys. He holds a JD from Stanford Law School, so he's a smart guy. He's also the best-selling author of It's Not That Complicated. And if you'd like a copy of that ebook, send me an email. I can send you an electronic copy of that book if you'd like. It's a good book. His approach to Medicare planning, it's been featured in the New York Times, the Wall Street Journal, and Forbes. So he's got some, pretty credible people that have profiled what he's doing. He's originally from Chicago, but he's now in Phoenix with his wife, his daughter, and his 2 dogs. Fellow dog lover. I love that. So in this presentation, Ari's going to go through the basics of Medicare, along with some of the thorny complications that might come up along the way. He'll also touch briefly on what makes Chapter unique. And again, this isn't a sales pitch, but I think it's important for you to be educated when you're deciding who you want to talk to about your Medicare needs. And they really take an education first approach, and they search across 24,000 Medicare plans nationwide to find the single best fitting plan for you. So I'm going to ask you to do one thing: get out a pen or get your phone. I'm going to give you a phone number. And if you guys want to call them, this is the number to call. Okay. So I'll give you a second to get your pens. When you call them, they got hit with the Amazon AWS. You probably have been reading about that. They got hit with that. So there's a long delay right now on the phone calls, but you don't have to wait. You dial this number and it'll ask you on a prompt. You just want to have them call you back, say yes, and you'll get a call back right away. So that's the way to go. Here's the number: 775-565-0284. One more time: 775-565-0284. And they will not charge you a dime. There's no obligation to do what they recommend. It's just a one-on-one consultation where they'll present to you what their algorithm sees as the best plan for you in your area. So with that, Ari, take it away.
Thank you so much for the introduction, Fritz. It's a delight to be back with you. We did a Medicare 101 presentation together a couple months ago, and if you want to view that, you certainly can. It's on Fritz's YouTube, and this is going to be posted to Fritz's YouTube as well. So what we're going to cover today are the basics of Medicare, the alphabet soup. Then we're going to talk about your 2 options for additional coverage, either Medigap or Medicare Advantage. And finally, we're going to talk about the steps that you can take to use the Medicare annual enrollment period to your advantage, to get the most out of it. And if you're already on Medicare, you have until December 7th to action the changes that we talk about in this presentation. So now let's turn to a little Medicare 101. You're going to know more than 99% of people by the end of this presentation. And I only have about 30 minutes of material and then we'll open it up to some questions. So picture Medicare as a three-legged stool. And this is what I write about in my short book on Medicare. It's not that complicated. Three legs. You need all three legs in order to have comprehensive coverage and to avoid late enrollment penalties. The first leg of the stool is your hospital coverage. What happens when you're inpatient? The second leg of the stool, everything outside the hospital, your outpatient coverage. And then the third and final leg of the stool is your drug coverage. Now, each of these legs corresponds to a part. Hospital coverage, that's part A. Outpatient coverage, part B. And finally, drug coverage, part D. D is in drugs. Let's unpack these key components a little further. Medicare Part A is your inpatient coverage. This also covers you when you're receiving skilled nursing facility care, home health care, and hospice care. You might be wondering, how is this paid for? It all sounds good. Well, Medicare Part A is paid for through your federal payroll taxes. As long as you or your spouse has worked for 10 plus years and paid federal payroll tax, then Medicare Part A has no premium. It is a $0 premium for Medicare Part A. Now, there is a deductible. It's substantial. It's approximately $1,700 per hospitalization. We'll talk about how to cover that a little later on. Then there's Part B. Part B is your outpatient coverage. This covers visits to your primary care doctor, visits to specialists, lab work, x-rays, MRIs, CT scans, even durable medical equipment like a heart monitor, a continuous glucose monitor, a wheelchair, or a walker is billed to Part B. Now, there's a monthly charge for Medicare Part B, and in 2025, the monthly charge is $185 per month. And there's no family plan. So if you and your spouse are each on Medicare Part B, then you owe $185 each, unless you're a high earner, which we'll cover at the end of the presentation. Now, in unison, Medicare Part A and Part B is referred to as Original Medicare. These are the twin pillars that were established under Lyndon B. Johnson's Great Society program in the mid-1960s. And Medicare is one of the most popular government programs. Fritz and I were talking before the presentation started. Fritz can't wait to be on Medicare. Unfortunately, he's 3 years away. But Medicare is excellent health insurance. It is very comprehensive, and I think many are surprised to learn just how strong their Medicare health insurance is. Now, with that said, I want to talk about what you get in return for that $185 per month that you pay for Medicare Part B. What you get is 80-20 coinsurance with the government. The government picks up 80%, you owe 20% out of pocket. There's no financial limit on the 20% you owe out of pocket. So my mom lives in the Chicagoland area. Last summer, she received a knee replacement. It's a $50,000 procedure in the Chicagoland area. My mom would have owed $10,000 out of pocket had she not had some type of additional coverage. The very next month, she slipped and broke her elbow. She would have owed 20% for everything related to her elbow as well. So her out-of-pocket exposure for last year would have been well north of $10K had she not had some type of additional coverage. The second big ticket item that Original Medicare doesn't cover is long-term care. Long-term care is defined by the activities of daily living, such as eating, bathing, dressing. Even cognitive decline goes to long-term care. And long-term care is known under synonyms: around-the-clock care, custodial care, 24/7 care, nursing care. These are all synonyms for long-term care. And as things stand today, there is no coverage under Original Medicare for long-term care. There have been proposals in Congress to add long-term care to Medicare, and it would simply be too expensive for the country to insure for. So there's no coverage under Medicare for long-term care insurance. If you're interested in long-term care insurance, the best time to think about it is when you're in your 40s or your 50s. By the time you reach 65, it's oftentimes too late and too expensive to insure for. So with that, it brings us to the third and final leg of the stool, Part D. The reason to get Part D, even if you don't take any prescriptions, is so that you avoid a lifetime late enrollment penalty. And that penalty continues to compound for as long as you forego Part D coverage. The only people who have an exception here are those who receive drug coverage at least as good as what Medicare Part D covers. And Part D needs to be purchased through a private insurance company. Unlike Original Medicare, it doesn't come directly from Uncle Sam. Now, I have some good news. There are 3 major improvements to Medicare Part D on the horizon, and in order to action these improvements, you need to review your Part D coverage before the December 7th deadline. So the time to action these changes is during the annual enrollment period, which we're in right now, and it ends December 7th. So the first significant improvement is that there's a maximum annual out-of-pocket cap of $2,100. In order to be subject to that maximum annual out-of-pocket cap, each of your prescriptions must be covered. So if one of your prescriptions isn't covered under the plan of your choosing, then that prescription isn't subject to the maximum out-of-pocket. So it's very important when we review your drug coverage that we make sure that the plan that you choose covers each of your prescriptions. The second improvement on the horizon is that now drug insurance companies are going to automatically smooth out your costs. So even if you're on an expensive brand name prescription or an expensive specialty medication, they're going to dollar cost average the $2,100 out over the course of the year. Previously, when you went to fill that expensive prescription for the first time, you might have needed to fork over thousands of dollars up front. That's no longer the case. And then the third improvement that I want to note here is that Medicare is going to be negotiating the price of 10 select prescriptions on your behalf. And if you take one of those 10 prescriptions, you should see significant savings. The big question that I want you to have top of mind as we go through this presentation is how will you cover the 20% of expenses that Medicare doesn't cover? Remember, at most, Original Medicare covers 80% of your medical expenses. You owe 20% out of pocket. What's more is if you just have Original Medicare, that is Part A and Part B, you have no protection against the deductible for Medicare Part A, and you also don't have prescription coverage. So when people realize that there are these deficits that they need to insure against, that's what motivates discussing what type of additional coverage you should choose. And as Fritz mentioned, the type of coverage varies county by county across the United States. There's over 24,000 plans nationwide. Broadly, we can sort those 24,000 plans into one of two types, however. The first type, which I call option one, is to keep Original Medicare and add a Medicare supplement plan, which is also known as Medigap. This sits on top of Original Medicare and it covers the 20%. That's why I like calling it Medigap. It covers the gap. It covers the 20% you'd otherwise owe out of pocket. If you choose option one, then the only other thing you need to add is a standalone prescription drug plan. Then there's option two. Option two is what you see advertised on television. You could pick your favorite Medicare Advantage spokesperson, Joe Namath, William Shatner, Jimmy Walker, you name it. What they're talking about are plans that replace Original Medicare with coverage through a private insurance company. It's managed care. And you might hear these plans referred to as Part C or an all-in-one plan. What they're referring to is Medicare Advantage. And again, this is insurance offered through a private insurance company and subject to the private insurance company's terms and conditions. So this is where we're in the world of network restrictions, HMOs versus PPOs, and it's also where we're in the world of prior authorization. And in 2023 alone, there were over 50 million prior authorization requests submitted to insurance companies. So if you value comprehensiveness and flexibility, then option one is probably for you. And it doesn't cost an arm and a leg in most states. So the reason that most of Fritz's viewers choose option one is because they appreciate not having to worry about whether their doctor is in or out of network. It beats a PPO. Over 93% of doctors accept Original Medicare, and almost every institution does as well. In fact, I'm not aware of an institution that doesn't accept Original Medicare. Well, I am aware of one, but we'll set that aside for a moment and we'll see if it comes up in the Q&A. The second reason that Fritz's viewers tend to prefer option one is because you appreciate the freedom to see any specialists you want nationwide without a referral. The Mayo Clinic, the Cleveland Clinic, MD Anderson, Sloan Kettering, you name it. There's no HMO-like features to Medigap. The other thing that Fritz's viewers tend to appreciate is that there's no bills or copays. There's cost certainty. Once you hit your Part B annual deductible, you will not see another Medicare-approved expense thereafter under the most comprehensive Medigap plan letter type. The Part B annual deductible for this year is $257. If you compare that to my work-provided coverage, my wife, daughter, and I have a $6,000 deductible, meaning we don't see a dollar of benefit until we hit our $6,000 deductible. Under Medigap, your Part B deductible would only be $257 under the most comprehensive plan letter types. And then finally, Medigap is designed to last a lifetime. So the way I train our team here is marry your Medigap, date your drug plan. If you're in your early 60s, if you're turning 65, actuarial tables suggest that you have 30 to 30, you will live 30 to 35 years. You are making a long haul purchasing decision. So think long term. If you are taking into account how your health might change in your 70s, 80s, and 90s, then oftentimes we find that option one will work better for you as you age and tend to need more healthcare expenses. So marry your Medigap, date your drug plan. The time to marry your Medigap is when you first start Medicare, because in 46 states, you have a one-time opportunity to choose Medigap without any questions about your health history. Every year will help you date your drug plan, though, and action those savings that I mentioned on the improvements in store for Medicare Part D. So marry your Medigap, date your drug plan. The annual enrollment period is the time for you to date your drug plan. And on average, we help our members save $1,100 on their healthcare costs by reviewing their coverage every year. So the most comprehensive Medigap plan letter type for someone who recently turned 65 is Medigap Plan Letter G. G as in Gilbert. And here's what people love about Medigap Plan Letter G. First, there's no network restrictions. Second, there's no referral required for a specialist visit. Third, there's no additional bills or copays once you hit your Part B annual deductible, which is $257 in 2025. Plan G works nationwide, so if you own a second home in a different state, if you winter in Florida or Arizona, if your grandchildren live elsewhere and you're planning to spend a lot of time with your grandchildren, then Plan G is likely for you, or if you own an RV for that matter. And finally, I want to note that Plan G includes 80% international coverage when you travel abroad. And this story actually got picked up by the Wall Street Journal. We had a client who was vacationing in France. They suffered a heart condition. They racked up $30,000 in a multi-week stay in a hospital outside Paris. Because they were on Medigap Plan G, we were able to help them get $24,000 in reimbursement, so it didn't ruin their trip. Now let me say a little bit more about option two. And remember, it's option one or option two. They're mutually exclusive and you can't have both. Option two, Medicare Advantage, is a replacement for original Medicare administered by a private insurance company. What people like about this coverage is that it's all in one. It typically includes prescription drug coverage, and some plans include additional benefits like dental, vision, and hearing. What people also like is the price. You still owe your Part B premium, which is $185 per month in 2025, but then the premium for many Medicare Advantage plans is $0 per month. However, there are trade-offs. The trade-offs are that these plans restrict the doctors that you can see. If you see an out-of-network provider, your plan might not have any coverage, or you might pay more for your healthcare costs when you see an out-of-network provider. And also, these plans are subject to prior authorization, which means the insurance company gets a veto over the care that you and your doctor think that you should receive. The insurance company can actually deny those healthcare requests. So these are certainly trade-offs to consider. If you can afford it, option one tends to work better for Fritz's audience, but I did want to mention option two in case you're very healthy and you want to bet on your health, or if you don't go to the doctor very often, or if you're cost conscious and you prefer to save money on your health insurance and pay a lower premium in exchange for paying copays when you see the doctor, or perhaps having co-insurance.
Hey, Ari, let me throw one in here because I got this. I'll throw the question in here just as it's relevant. I've had some people approach me and say, look, I started on Medicare Advantage. Obviously, the perception is you can address this if you want, but as you get older, it's a higher risk because of the pre-authorizations, et cetera. Can you change if you started with a Medicare Advantage option two? Can you change during the annual enrollment period to option one, Medigap?
Yes, you're a step ahead of the presentation.
Okay.
Yes, you can.
Okay, sorry.
Now in
I
46
haven't seen it
states,
beforehand. Yeah.
No, it's a great question. In 46 states, you may have to answer questions about your recent health history, but it's not like a life insurance exam. No one comes and takes your height and vitals and draws your blood. It's just a few questions about your recent health history. Those questions vary insurance company by insurance company, and it's something that our advisors have at the touch of our fingertips. So you can certainly consider whether to switch from a Medicare Advantage plan to Medigap during the annual enrollment period.
Okay, thank you.
So here's how we help evaluate which option is right for you. We use the 3P framework. Your 3Ps are the providers. What are the doctors? What institutions do you want to go to? We want to make sure that they all accept original Medicare, or if you choose Medicare Advantage, we need to make sure that all of those doctors and institutions are in network. The second P, your prescriptions. What medications do you take? Brand name or generic? What pharmacy do you like to go to? A national chain or a mom and pop drugstore? This factors into finding the single best fitting plan for your needs as well. And then the third P, your priorities. What's important to you? Again, do you own an RV and plan to hit the road? Do you plan to travel internationally? This type of evaluation is something we do in a one-on-one 45-minute consultation with you. And it just helps when you have your 3Ps ready. So have your providers, your prescriptions, and your priorities written out in advance of giving us a call. And then we'll discuss your 3Ps in a no obligation, no charge, one-on-one consultation, and we'll help you find which plan is right for you for 2026. And then we'll provide year-round ongoing support. You're always welcome to call the Medicare advisor that you worked with, and you're also supported by our member advocate team, which is your first line of defense for any hiccups that come up along the way. For example, if you misplace your ID card, our member advocate team will help you get another. If you have a question about a claims invoice, our member advocate team will help you decipher it and figure out what you actually owe. Finally, if you're at the pharmacy and you're charged an outrageous copay, our member advocate team will get to the bottom of it. Our member advocate team is really something unique about Chapter, and it's part of our ongoing commitment to our members. And so it's another thing that differentiates us from anyone else that you might have worked with on your Medicare. So let's talk about the Medicare annual enrollment period, which started October 15th and it ends December 7th. During the Medicare annual enrollment period, if you're already on a Medicare Advantage plan, you can use the annual enrollment period to adjust your coverage for 2026. You can also use the annual enrollment period to return to original Medicare and potentially to choose a Medigap plan and the standalone drug plan of your choice. In 46 states, if you're outside your one-time Medigap open enrollment right, you may have to answer questions about your recent health history, though. The final thing that you can use the Medicare annual enrollment period for is to review your prescription drug plan or to sign up for a drug plan if you haven't signed up for one yet. So a question in advance. I like my current plan. Do I still need to schedule a Medicare consultation? It's recommended because the plans change every year. Your Medigap plan is standardized under federal law. That won't change, but the drug plans change and the regulations change. If you're on Medicare Advantage, the premium and costs associated with your plans change, the benefits offered by your plan change, and the physician networks can change even mid-year under Medicare Advantage. So this is something that is important to review. The time to do so is now, and just make sure you work with an independent, unbiased advisor that can help you evaluate every insurance company and every plan offered in your zip code. And that's something our advisors have at the touch of their fingertips. So here's your checklist for the Medicare annual enrollment period. First, over the last month, you should have received your annual notice of change in the mail. The second step is think about whether this plan is the right one for you. Think about your 3Ps. Write out your doctors, write out your prescriptions, write out your priorities for the upcoming year. They may have changed. And then third and finally, schedule your free Medicare consultation. We'd be delighted to help you. And it's something that people don't realize that they can review their coverage every year. Over 70% of people don't take us up on the offer to review their coverage. 70% of people won't review their coverage for the annual enrollment period. Don't be one of those people. Instead, take the time to make sure that you're on the single best fitting healthcare plan based on your 3Ps for 2026. You might have been on the right plan for 2025, but again, the standalone prescription drug plans and the Medicare Advantage plans change year over year. So that's why it's important to do this every single year. So here's how Chapter can help you. First, for those who are turning 65, we can help you once you're in your initial enrollment period, which is the 3 months before you turn 65, and it extends to your birth month and 3 months after you turn 65. The only people who have an exception to delay starting Medicare are those who work for a large employer, meaning 20 employees or more, or your spouse works for a large employer, 20 employees or more, rule of 20. Those are the only people who have an exception to delay starting Medicare. So the second bucket of clients that we help are those who are on a large group employer plan, meaning 20 employees or more, and you or your spouse are planning to retire soon. We'll help you activate your red, white, and blue. We'll help you get your red, white, and blue Medicare card. We'll help you evaluate your options for additional coverage. We'll help you submit all the paperwork, and then we'll provide year-round ongoing concierge support. The final bucket of clients are those who are already on Medicare, and a lot of this presentation has been geared towards you, so don't forget to review your coverage by the December 7th deadline. And with that, it brings us to the frequently asked questions, but before we get there, while Fritz surfaces them, I just do want to put up that number that Fritz mentioned at the outset. For Retirement Manifesto viewers, the number to call is 775-565-0284.
Okay, thank you very much, Ari. And I don't see on this, I see a chat. Let me see if there's any questions in the chat. I apologize if anybody's, no, there's not. So you guys can, if you look down at the bottom of your screen, there's a little chat thing. If you want to type in a message there, we can see it there. But as we're waiting for those to come in, quite a few of you responded to my email, and I said, hey, if you've got a question, go ahead and shoot it in to me. So I've got a list of these questions. I'll kind of keep them general because there were some common themes. But one that
Fritz,
I thought was interesting.
do you want me to start with the questions that were emailed in advance?
Oh,
I have
you put them on there? Sure. Yeah.
Oh, yeah.
If you've already got them in there, that's great. I was going to read them.
Your viewers are so on top of it. Let me get to a few that
I'm
they
impressed.
emailed in. The first one is, my prescriptions haven't changed. Should I still review my coverage beginning October 15th? And the answer is yes, because the regulations have changed. So certainly review your prescription drug coverage. I assume this viewer is already on Medigap. The annual enrollment period is the time for you to review your prescription drug plan. You can shop your Medigap plan at any time. And remember, Medigap is standardized under federal law. So each Medigap insurer must offer the same hospital and medical benefits for each given letter type. So why pay more for your insurance? The second question that was emailed in advance is, can I use the annual enrollment period to switch to a Medigap plan? And the answer is yes. In 46 states, you may have to answer questions about your recent health history. The only 4 states that are an exception are New York, Connecticut, Massachusetts, and Maine. So they're all along the northern Atlantic coast. New York, Connecticut, Massachusetts, and Maine. You don't have to answer any questions about your health history. If you live in one of the 46 other states and you say, gee, I wasn't aware of option 1, Medigap sounds really good to me, give us a call. Let's see if you can qualify. You may even have a guaranteed issue right if your plan is being terminated, for example. That's something that we can speak to you about in a one-on-one consultation with one of our licensed Medicare advisors. The next question is, I'm past age 65 and planning to continue working for at least another 2 to 3 years. Do I need to enroll in Medicare Part B? The answer is no, as long as you or your spouse work for an employer with 20 or more employees. Rule of 20. And then remember, the standard Medicare Part B premium for 2025 is $185 per month. So one of Fritz's viewers asked, what is the income-related monthly adjustment amount and does it apply to me? So the income-related monthly adjustment amount applies to high earners, and the government considers you a high earner based on a 2-year look back. So for 2025, the government is looking at your 2023 tax return. And if you're a solo filer and you earned more than $106,000 modified adjusted gross income, or if you're a joint filer and you earned more than $212,000 modified adjusted gross income, then the government considers you a high earner, and these amounts are graduated. But what if you've had a change in life circumstance? If you've had a change in life circumstance, then you can use Form 44 to appeal. And there are 8 life-changing events that the Social Security Administration spells out for the purpose of appealing your IRMA. The 2 most common are work stoppage or work reduction, and sadly, the 3rd most common is divorce. But if one of these life-changing events applies to you or your spouse, then you can instead request that the government look at a more recent year. For example, your 2024 modified adjusted gross income, or even your anticipated modified adjusted gross income for 2025. This is a 3-page form, and it can help you save $10,000 to $12,000 for a couple if you successfully win your appeal. And it's another differentiator for Chapter, because it's something that we spend so much time training our licensed Medicare advisors on. So that way you're not overpaying for your Medicare premiums. And there's
Let
two
me jump in, Art.
Oh, go ahead.
Yeah, go back one slide if you don't mind. Yeah, this slide right here. Just for the readers of my blog, a lot of them are doing Roth conversions. And just to make people aware, if you do a Roth conversion, that counts as income. So maybe you're pulling in, let's say, $60,000 Social Security, and you're like, oh, I'm way below the 200,000. But if you're doing Roth conversions that you put you over that limit, that's something you need to pay attention to, because you will pay higher Medicare costs 2 years out if you do a large. I'm 63 next year, and I'm starting because I'm doing large Roth conversions every year. For next year, I'm going to look at this. They call it IRMA. I'm going to look at the IRMA charges and figure out, do I make that my break point, or do I go ahead and go up to the top, the tax bracket? And if you go $1 over the IRMA limit, you get hit with that upcharge. So it's pretty important to understand that Roth conversions will affect this.
Yes, the government's acronym is IRMA. I love that acronym.
Mm-hmm.
All right, let me end on this slide. And then Fritz, what we're going to do is I'm going to end the recording of the presentation, and then we can take questions from the attendees. So I'm just going to end the recording.
Perfect.
And then
Yep.
we can get into, your viewers can raise their hands and we can answer their questions in a more intimate setting.
Perfect.
Sound good?
Yep.
All right.